Hi once again. In this particular video, we'll be looking at how to relieve a choked victim. Now, choking, we need to take a serious look at it because it restricts somebody from breathing adequately. So realize that this victim is finding it difficult to breathe and is showing a universal sign of choking or a universal sign when somebody is choked. So realize that he's clinging to the neck or he's holding the neck. That's a universal sign of choking. Another sign of choking is that the person finds it difficult to complete a full sentence. They have a watery eye, they become restless. In other rare situations, the lips become bluish in color, which we call cyanosis. Now, as a rescuer or somebody to rescue the person from being choked, the first thing to do is to ask the person, are you choked? Then the person nods. So he's telling you that he or she is choked. Then the next thing to do is to encourage the person to cough it out. So you tell the person, please cough it out, cough it out. And it's finding it difficult to cough it out. So now you, as the rescuer, you are supposed to help the person to relieve from the choked of substance. So you now come to the back of the victim this way and place your leg in between the patient's legs and stand in a firm position. Now place one hand on the patient's chest to form a support. Then you are going to provide a 5 back blows in between the patient's shoulder blades. So we have the right shoulder blade here and then the left. So this side, you are going to use the heel of your palm in applying a back blow. So you hit it hard. Now the reason why the patient is leaning a little bit forward is the reason of force of gravity. So when you hit it hard, you are indirectly pushing the object out of the patient's airway. So the patient will be relieved from the choked substance. So hit it hard 5 times. So 1, 2, 3, 4, 5. And then you check if the substance is out. If the substance is not out, then you do what we call the abdominal thrust or the Heimlich maneuver. So we look at how to do it. You first locate the patient navel, form a fist, place it on top of the patient navel, just about 1 inch or 2 inches. Then support with the other hand. Still the same position. You are going to provide an inward and outward movement or thrust. So you provide it this way, and you are doing it 5 times. So you do it 5 times till the object is out. If the object is not out, you repeat the 5 back blows. If the object is still not out, you continue with the 5 abdominal thrusts till the object is out, or until the patient goes unconscious. If the patient is unconscious, then you follow the basic support. So that means you are going to check for pulse. If the patient is pulseless, then you provide cardiopulmonary resuscitation to the patient. Now, somebody will ask, assuming the choked victim is a pregnant person. Now remember, in this situation, you are going to cater for 2 victims. Primary, the mother, and then secondary, the baby itself. So if you provide an Heimlich maneuver or abdominal thrust, which is this way, you are now going to hurt the patient or the mother's womb and then hurt the baby as well. So in order to prevent any injury to the patient's womb and then injury to the baby, you are now going to provide what we call chest thrust. So just below the pregnant woman's breast, close to the breastbone, then you form a fist this way, flat fist, place it there this way, support it, and then you are going to provide a chest thrust. So it's going to be in and then out. You provide it this way. That is for only pregnant women or obese patients. So you provide it in and outward. For Heimlich maneuver, abdominal thrust, you form a fist this way, use the bony part. But for the chest thrust, you form it a flat way this way, and then you locate it just under the patient's breast, at the breastbone, below the breastbone, support with the other arm, and then provide an inward and outward chest thrust. Thank you very much. This is how we do to relieve a choked victim. Thank you very much.